Out, yes, and here we go. PNR204, exam 3, last exam. We know next week will be the exam, and then after that, we're starting all our HESI reviews. If you don't get your math calculation form that I've just made for this new exam, I just got done with it yesterday and posted it on the announcements with all the cahoots and everything, the reviews, the cahoots, the PowerPoint, and the form are there. So one place for you all to go looking. That's my class. I sent it out to them yesterday. It's not there yet. You need it. Let me know. And I'll post it on the class. I have access to be able to do that because 10 points, not a point should be given away out of those 10 because of dosage calc. I've given you all your tools. So
Can you please do, because I didn't see it in my class announcement, please.
which class, what day?
Professor L,
All right, so you're the Monday class.
Tuesday.
Yeah,
I mean,
and
Tuesday morning. Okay, perfect. All right, not a
Tuesday
problem.
and Professor Styles as well, please.
All right, I'll just go ahead and post it. Don't worry. I'll take
Okay.
care of
All right.
y'all.
Thank
Not
you.
a problem.
Thank you.
You're welcome. Come on. All right, here we go. Always, 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 you're going to have your definitions, and you know you're going to see definitions on this quiz, so this exam. So I'm going to try to make it explainable, but you can remember that. So atelectasis is what happens post-op. You don't deep breathe, you don't cough, and the end of the lungs, that little alveoli, they collapse, which means no oxygen and carbon dioxide are being exchanged. So atelectasis, and then we know how we take care of that. Deep breathe, cough, get out of bed, right? Ambulate. Coryza, I think it's a great name, but it's a common cold. But it's, oh, I have coryza. People will think that you're infectious, normal people, right? Now remember, allergies, there's no fever with it. You're sneezy, you're itchy, and you're watering eyes. That's the difference between like cough and cold. Stridor is when you pull air in and the upper airway is blocking it in some manner. We went into croup. So probably it is that croup type of thing. It's called stridor. And it's when air is trying to get into an airway and it's narrowed and it's trying to get in, depending on the severity of the swelling. Now, surfactant is what keeps everything open in the lungs. It's like the pillars that hold alveoli open and it holds the bronchioles open. Surfactant, it's usually you're born with it and you keep it and it's not a problem. They say, actually, for your information, at 34 weeks, newborn has surfactant. Before that, we might have to give artificial because they're a little early. Tachypnea, tachycardia, tachy always means too fast. So tachypnea is elevated respiratory rate. Ventilation is breathing in and out. Erythrocytes are your red blood cells. We started to talk to that about in the anemias, right? What do erythrocytes do? Red blood cells, they carry oxygen. So if you don't have enough erythrocytes or red blood cells, you're not getting oxygen to the body, and the body does not like that, okay? So goes into the lungs, gets this O2, gets rid of CO2, and then keeps going to the body. So they're really hard workers of the body. Now, oxygen saturations in children, we will accept any value 90 or greater. If it gets below that, we would administer some sort of supplemental oxygen depending on where the number was. So 90% is good for children. Signs and symptoms of respiratory distress. And I want you to know this can be children or it can be adults, doesn't matter. Respiratory distress is distress. Tachypnea, you're breathing fast. You're going to have noisy lungs, rales, rhonchi, wheezing, stridor, expiratory wheezing. All of these things you're going to hear with respiratory distress. Then what about all those retractions? Increasing use of accessory muscles. You're going to see some cyanotic things going on, like the nail beds will be part of it as it continues. And because of respiratory distress, you're not getting oxygen around to the body. into the brain, you're going to be confused. You're going to be irritable. You don't understand because your body is not giving your brain oxygen that it needs to think. All right, common respiratory illnesses. Well, the first is just the sore throat. That's a virus. How do we treat any virus? We do acetaminophen, ibuprofen, extra fluids, and rest. That's a viral illness, period. Now, if it's a streptococcal, we know that that is a bacteria and we need to treat it. Now, there are some things that are dangerous if we do not treat a strep infection completely. So prompt treatment is really needed for strep throat to avoid things. Rheumatic fever, remember that can cause permanent heart valve damage, carditis, right? Familiar nephritis, that means the kidneys stop working and you start filling up with fluid, and it can be a chronic, not just an acute stage. Of course, peritonsillar abscess, it's an infection in the upper airway, ear infections because it goes up the eustachian tubes. And then it gets into the bones, mastoiditis gets into the brain, and pneumonia. All of these things are due to strep. So you can see why teaching a parent and child to take all of their antibiotics till complete and then get rechecked afterwards is so important. There are some very dangerous diseases there. Again, upper respiratory infections, remember that's just a blanket viral. It is just supportive treatment. Again, one of the things we need to make sure is if they have a fever, of course, treat it. But remember, there's insensible type of water loss. You need to replace it. So small amounts of liquids. My grandson, give him apple juice and he'll drink that even if he don't feel well. It's one of those things. If the kid likes orange juice, milk, whatever it is, give it to them. Little fluids are really good for them. Bronchiolitis is another word for respiratory syncytial virus, or RSV. We've all heard of RSV and we go, oh, this is, a dangerous thing. Well, for me and you, it's a common cold. But for an infant, it's extra mucus in the airway, and they're already breathing through their nose and trying to eat bottles or breaths, right? So it causes problems like that. And it's that little fever that don't make them feel well. RSV is viral. Respiratory syncytial virus. So we treat it, acetaminophen, ibuprofen, extra fluids, right? And then rest. That's what we're going to do. And it's usually in your younger kids, as I said. They say in this 6 months to 2 years, you can see it even earlier. That first year is really rough on them. Asthma, many kids have it, grow out of it. Some adults still have it. It is one of the principal causes of school absenteeism in children because they don't know all of their allergies and what's there, and then they get triggered and they have these asthma attacks. So we know that it's a chronic respiratory illness and does cause school absenteeism, doctor's visits, ER visits, and it does encompass a lot of time in medical things for those children. Laryngotracheal bronchitis. That's the larynx, the trachea, and the bronchi. That's croup, upper airway. This is the inspiratory, all upper. Air getting in has a hard time. So that's called stridor. It's that type of sound, which is high-pitched and its group is called stridor. Epiglottitis. Now, we have the epiglottis in the throat. It covers the trachea when we swallow, so that food or liquid drink doesn't get into the lungs. Well, when the epiglottis by itself just swells up, usually due to a virus, sometimes strep, it just covers up that larynx and you cannot breathe. It is H. influenza, that's the big virus that it causes, and you can't get air in. So it is a life-threatening emergency. I've had one student say, well, just give them oxygen. Well, you can't get air in. How are they oxygenating? So this would be the one that you'll prepare for a tracheostomy placement or even intubation, because you got to open the airway, because airway, and oxygen blowing is blowing in the air. Nothing's going in. Now, cystic fibrosis is genetic. It's hereditary. It's given to children from their parents, and it's twofold. It's lungs, all full of thick secretions and needs aggressive respiratory care. And then it's also small intestines, has to do with the absorption of nutrients, basically fat. So thick secretions are up in the, and for the digestive problem, we give a digestive enzyme. Usually it's called pancreatase is the name of it. What happens is your fat is not absorbed. So you're losing all your fat vitamins and fat calories. Do you remember nutrition when they told you how many calories per gram of something was? Protein and carbs are 4 grams, 4 calories per gram. Fat is 9. So you have to eat double the amount of protein and carbohydrates to get the nutrition they need. So as we are with the cystic fibrosis and you're not absorbing the fat, what happens is you have these stools that are very bulky, they're frothy, almost like beer froth type thing, and they smell very, very foul smelling. And one of the ways how do we identify cystic fibrosis is through a sweat test. It's because you lose salt like crazy through your skin. So your electrolytes, we're going to be monitoring electrolytes, we're going to be monitoring nutrition, and we're going to be monitoring respiratory status. And one of the things that happens is infertility. Women can have children most of the time. Most of the time, it's the male cannot give the sperm to the woman because there's ducts in their testicles that are clogged and blocks the sperm from going to the woman. They say 1 year after a bilateral lung transplant, they can have children, and many men do that for their women. Okay, cardiac, everybody's like, oh, cardiac. Well, a couple of things we need to know. Remember, tachy is fast, brady is slow. Dys, whether it's dyspnea or dysphagia, is all difficulty, abnormal, you can't do it. Hypo is less, O is less. Usually we describe that as a small area in the heart, like hypoplastic left heart. The heart muscle's all thickened, it's not working, that muscle of the heart is just, it's nothing. Shunting. When you have blood or any secretions, it always goes from where you have a lot of it or high pressure, it wants to go to somewhere else where it's lower pressure. It shunts, okay? Think about, and this might help you with the heart, think about your ears and ear infections. You have all the mucus in your throat, right? Where does it end up going? In your ears. That's why you get ear infection. So it's shunted into the ears. In the heart, it would mostly go from, if there's holes between chambers, it would go from the left side to the right side. The right side, blood just gets there, right? That's the last of a heartbeat going into the right side. So that's the shunt. Murmur is what you hear when there's a valve problem or a hole in the heart. They can be described many ways. Cyanotic is the color that we see. What the child looks like. You're going to see bluish, purplish discoloration around the lips, fingers. You will see that. It is an indicator of low oxygenation. I've said that I had a child that had, she had, let me see. I'll keep going. I looked up and saw my husband. Acyanotic. So we have cyanotic where they're just absolutely, O2 saturations are low, and acyanotic is when there is none. The cyanotic, what I was going to say. I had a child who had a tetralogy TET spell. That means the blood's not going now to the lungs. They went from a beautiful pink color to blue in 10 seconds. That cyanosis was so evident. That's what I wanted to tell you about. And stroke volume is just the amount of blood that's pumped with one contraction. Atrial septal defect. Well, to understand this, we know that there's 4 chambers in the heart. The middle part is called a septum that changes the right and left side so they don't connect. Sometimes you're born and there's a hole that remains in the upper chambers. They're called atrium. The hole there is an atrial septal defect. And remember, right side, blood just gets there. It's very low turbulence and flow. But that left side's getting all the blood back from the lungs. And there's actually 4 pulmonary veins. So a lot of pressure's going in. So yes, it goes from left to right side. Usually you're not wrong. Shunting is left to right, okay? How do we treat it? Well, we could do surgery and close it, or sometimes we can go to the cardiac cath lab and close it. There's these packed things that are used. So what is a VSD? Well, we had the upper chambers, atrium, while the lower chambers are the ventricles. If there is a problem with there's a hole, again, think about the left heart is pumping, you know, the big engine of the heart, it's going to go again, shunting left to right, always. Surgery is done. Sometimes they're small, they let them grow out of them or grow into them. Again, some cath closures for that too. Patent ductus arteriosus is fetal circulation. It connects, think about unoxygenated blood to oxygenated blood. That's what you need to understand. So it connects the lungs, pulmonary artery, to the aorta, which is the body, wouldn't have anything unless it was connected in some cases. It is an important thing that we have there. With some of our conditions, it helps oxygenate the body. And the one thing that we look at with this is their blood pressures. And the interesting thing is, number one, you hear a washing machine murmur, and the blood pressure is wide. Now, a normal blood pressure on a newborn is 60/40, right? These children could have 60/18. And as it closes, like if normally, or with medicine, indomethacin, it will come back to normal and you know it's closed. Sometimes they go in and they staple it, and that's surgery. Coarctation of the aorta is a kink in the aorta. So blood comes out the left side, up to the body, over the arch, and it kinks. No blood can go down, or minimal blood can go down. What would you see? You would see diminished or no pulses in the lower extremities, none. And the upper extremities, because that's now where the blood's going, it's going back and back into the upper, it's going to be higher. So 4 extremity blood pressures, the upper extremities are higher and the lower ones are lower. This is where we do an aortogram, look at the aorta and we find it. Sometimes they do surgery for it, sometimes they do a balloon and just pinch it open. I've mentioned tetralogy of Fallot. It is 4 things that happen, but basically it's the pulmonary artery that sits in the right ventricle. Somehow it kinks, something flaps on it, it spasms, the valves don't work, and blood can't get into the lungs. So this blood is coming back from the body. There's no oxygen left hardly, trying to get back to the lungs and it can't. So this is the one, when that happens, it's called a TET spell. These children go from a saturation of 100, I've seen them go down to 10 in about 15 seconds. And they turn black, blue. They really, the cyanosis is very evident. So I was a nurse one night, it happened. I was just, cleaning his mouth a little, fixing him up, turning him, doing my assessment. He went into spell. What you do is you take their knees and push them up to the chest, whether on the side or laying them on their back and push it up. And why do we do this knee chest thing? Well, you have pressure in your abdomen and in your thoracic areas. And that pushing the knees on the abdominal cavity forces pressure, forces backflow to go up into the chest cavity, and it pops open what's ever causing that flap to not let blood go. And it works. Now, these children do need surgery. They can't live their life having TET spells, but it's more of a scheduled, it's not an emergent. I mentioned the hypoplastic left heart. It is that left ventricle don't work. That means your engine of the heart don't work. It is everything in that heart, all of the anatomy looks different. And the thing about the hypoplastic left heart, you've got to figure out ways to open up passages and allow blood to get to the body. So we're opening up things, we're putting ducts in, we're connecting inferior vena cavas and superior vena cavas. And all you need to know is there's 3 surgeries. And it's usually up to the age of 5 years old with cardiac caths in between. These children go through a lot, okay? They can live with it. Many of them end up with a heart transplant about 8 or 10 years old. In fact, all the ones that I know, they had heart transplants. So diagnostic tests, I've already mentioned the aortogram, looks at the aorta, puts a dye in it, looks at it. Where's it kink? Now we know where it's at. Children who come in that you think they're cardiac is absolutely getting an echocardiogram. We're going to be looking at the way blood flows and the structures, etc. And if we're finding a problem, not right, that child's going to go for a cardiac cath for further investigation. So signs of heart failure or congestive heart failure, either or the same, it's the same thing. So congestive means you're filling up with fluid. So all of a sudden weight gain. Why do you think we do weights on all children every visit and in the hospital every day that they're there? We're looking for sudden weight gain and weight loss. So sudden weight gain is a big thing. And then you'll see them, they're tachycardic and they're sitting there doing nothing. And they're getting short of breath, probably tachypneic and dyspneic altogether. Complications, now you got all this extra fluid in the lungs, and now you're going to be worried about things like pneumonia, meningitis, glomerulonephritis, otitis media, all of these things. And again, remember that rheumatoid, they're going to be on a prophylactic antibiotic penicillin, right? And that's always in front of doing things. So all cardiac. Again, congestive failure, same thing I just said, tachycardia. Because their lungs are full of fluid, they're not getting all their oxygen. So that little bit of energy just to eat, drink their formula or their breast, they tire out so easily. And you'll see them sweating, during this, and then all of a sudden they're tired, they fall asleep, and now they're difficulty breathing. You're going to watch their heart rate go up too. So it's all signs of my heart's giving up. And remember, heart is oxygen, no oxygen. You can imagine, I'm tachycardic, I'm tachypneic, I'm sleeping, I'm exhausted, and then the sudden weight gain. So with children like this, you've got to be really careful how you care for them. You can't think that you're going to do a major overall bed bath and clean them and, oh, they can't tolerate that. This is that little tiny little bath slowly over a 12-hour period, what I do. I wouldn't do it all at one time on this kid. You organize care. If they're crying, feed them. It's usually what they want. The kid wants to eat, feed them, especially when they have a heart that's bad. Keep them quiet. So food sedates them. That's what we want. Small, frequent, you can put high calories into either breast milk or in the formulas. Oxygen, we can give, that helps with the dyspnea for sure. And always with children, especially cardiacs, there's a lot of cardiac drugs, make sure that you give them as prescribed and always check those dosages for safety. Again, looking at the weights, especially from one admission to the next, making sure they're getting enough or not too much. And when we're talking about congestion, fluid, and failure. Always intake, output, daily weights. Any fluid balance problem, intake, output, daily weights. The rheumatic fever is due to that beta-hemolytic streptococcal infection in the throat that wasn't treated properly or needed further treatment and they didn't follow up. It involves the joint, the heart, the central nervous system, skin, subcutaneous tissues, and it's the mitral valve in the heart. That's the one thing that we cannot reverse. All of the chorea, the central nervous system, the movements, the joints, rashes, all of that stuff will be turned around, but not the heart valve. That will need to be treated medically or surgically. So what do? Penicillin is a strep infection that wasn't treated, that went and became rheumatic fever. Treatment is long-term antibiotics. And this is the one that we're going to be given that monthly antibiotics, minimum of 5 years, because we want to protect that heart from further damage. That's the big thing. So inflammation of the heart caused by rheumatic fever is called carditis. And that chemotherapy that we give for the antibiotic is to help keep that heart free from infection and protecting valve. We also have them on rest. The valve is there, right? The valve's not working right. You're going to rest them. And then, of course, any pain, fever, the joint swelling, etc. We're going to give NSAIDs, the anti-inflammatory, steroids. And this will be one of those children we'd give aspirin to, just to get the blood flowing. They're looking more towards Coumadin now, but we're saying aspirin because that's what our book is in right now. And if the heart starts to fail, we're going to treat them like heart failure. You know, feeding, shorter periods of time, more frequent, higher calorie, and again, daily weights, intake, output. Now, hypertension, we don't like to treat meds immediately on anything with kids. We can do things to turn it around. So we put them on a DASH diet, low fat after 2. Right? We need the fat up to age 2. But then after 2, low fat products, fruit, vegetables, fish, poultry, and low sodium. You know, very important that we watch that. And if they're at home, again, I'd be having them watch their weight, looking for the sudden weight gains, because that could make the hypertension get worse. Hyperlipidemia. You know, we have LDL and we have HDL. And it's just extra lipids and fat. And yes, children do get high cholesterols. You know, we're like, well, we're finding out they get hypertension younger than we ever thought before, because now we're measuring it. Also, we're measuring now cholesterol and finding out they are having high levels. How do I remember good and bad cholesterol? LDL is lousy cholesterol. That means it's bad. HDL is healthy cholesterol, so it's good. And that's how I remember it, okay? So blood disorders, anemia. The most common of all blood disorders and anemia, iron deficient anemia. We knew that one, right? But what is anemia? Well, anemia is those erythrocytes, those red blood cells. We don't have enough. And what happens is oxygen isn't going around to the body. The body doesn't have energy and it's chronically tired. And then if it's a younger child, they're not going to eat right, they're not going to have nutrition, and then all the other problems, they will be growing, cognitive delays, et cetera, et cetera. Now, it can be acute or chronic, depending on what the anemia was from. It could be inherited or acquired. We know sometimes anemia is they don't produce enough or they're destroyed quickly. They don't last long. So iron deficient anemia is the big one. One of the things about iron deficient anemia, it's all related to food. So with iron deficient anemia, we need to replace the iron. The group that seems to be the most children that seems to get it is because they're young and the way they eat is toddlers. Remember, toddlers are picky eaters. They don't like to eat, you know, all those green leafy vegetables and whatnot, right? They're more picky eaters. And also, what else happens at age 1? We wean them off breast, we wean them off formula. So no iron is getting into that child. So now we have to eat it through nutrition, and they're not. Very common for a young toddler to be iron deficient anemia because of those things. So iron is usually a liquid. You give it through a straw. We like to give it with orange juice because the acid helps it digest and become a product that it needs to be able to be utilized. We don't do it after meals, always before meals. We need an empty stomach. Iron-rich foods are liver, leafy green vegetables, of course. I mean, many of you don't like either of them. Well, we can trick them today with many things. Hemophilia, your blood doesn't clot. There's some factor in your blood that's not there, and you just keep bleeding longer than normal. Hyperlipidemia is excessive fat and fat-like substances in the blood, cholesterol and triglycerides. Sickle cell anemia. This is hereditary, passed on by the mother and the father to the child. It's where their RBCs, the red blood cells, instead of being these nice round things, they become crescent shaped. And the problem with crescent shape is when the blood vessels are not plump and big, and they are going bifurcating into another set of blood vessels, they get stuck, especially with dehydration. Kids running around outside not drinking, right? Blood vessels get smaller. And it gets, now once one gets stuck, they all stick behind it because that one can't get through. And then it causes a lot of swelling and pain and death of tissue down below because it's not getting oxygen. So what is how we treat sickle cell anemia? Well, the cause is it can't pass through the blood vessels because they're too small. So number one, we're hydrate these children. And we're always to send them home, hydrate, always have something for them to drink, especially if they like sports, they can play sports. They need a little rest, of course, because they're anemic, but they also need fluids, keep the vessels nice and big, okay? And then we know oxygenation if we need to at that point, and it hurts. When they're in crisis, hydrate it, you're treating the cause, and pain, the symptom. We also take care of the pain too. Erythropoietin is used a lot, especially with chronic kidney failure. It helps regulate the red blood cell production and makes it produce more red blood cells. Thalassemia, I call it the rectangular shaped type cells that burst very quickly because sickle cell do, they die quickly. And it's usually we talk about thalassemia, we talk about Cooley's anemia, which is the highest level. Usually that's what's tested on. Again, it's hereditary. And you don't produce enough of the proper adult hemoglobin, okay? And it spews oxygen and it spews iron into the body. And then these children, the Coolies, are going to be needing to have blood transfusions to live. Their body aren't producing cells. They're not at all. Now, leukemia. This is when you have these immature white blood cells being produced that do not do any purpose at all. And they just, getting worse. Our normal white count is what, 5 to 7? I mean, that's a great number. Leukemia, you might have 0.1. I mean, it's like hardly any white blood cells. So our concern is all about infection because they're severely immunosuppressed, okay? One of the things we need to do is delay immunization, like no live vaccines. What would we do? If they're exposed to an infection, they need to tell someone so that we can give them prophylactic preventative treatment so they don't get these infections. There's no immune system going on. Because of everything and the chemo or maybe radiation, they're nauseous, they don't feel good. Whatever they want to eat, whatever sounds good, give it to them. Because nutrition is important. Even their mouth will swell sometimes. So meticulous oral hygiene, keep their mouth fresh. Try to keep it so they can eat food and enjoy it. Always make sure you check their skin, their mouth for any infections or ulcers because they do break down easily. And these children, even young kids, know what's going on. They're going to come to you and say, so am I going to die? Like, why is mommy and daddy crying so much? They're going to ask you some questions and it's going to be like a spear in your heart. So GI, GU. Well, here's another dys. This is your dysphagia, difficulty of swallowing. One of the things kids do is everything in their mouth, right? They love to take acetaminophen, the chewable things. Remember, acetaminophen causes hepatic toxicity. It'll kill your liver. So it's a very important one to get medical treatment for. GI disorders and problems, well, we know that when you're losing fluid, there's going to be a problem with electrolyte imbalances. We also know sometimes we lose fluid, we don't get absorption what we want, we have inflammation, and you have to increase, decrease fluids. Is it oral? Is it IV? A lot of those things we need to think about with them. Now, pyloric stenosis is infants, and they're usually about 3 weeks to 3 months, they say. But I've always seen 7 to 8 weeks old. They come in with vomiting, and you ask them, what does a vomit look like? Is it spit up, or is it across the room? You can aim it and hit something. Well, it is that across the room projectile. And it does need surgery, and they open up the pyloric valve. These kids do really well. Mecyldiverticulum, it is in the small intestines. This is diverticuli, and it bleeds, and they do surgery, and they get rid of it. Usually you will see a painless rectal bleeding on that. Appendicitis, just like adults, right lower quadrant. We know if it bursts, it's all of that material in that bowel is going into the peritoneum and causing peritonitis. You'll see the right lower quadrant, rebound tenderness, McBurney's point, and we will be doing testing. We do a CRP because it measures inflammation. A white blood cell count, because we're looking for infection, the white blood cells. And we do a urine and stool just to rule out other stuff. We'll look at an X-ray, a CAT scan, and usually a simple ultrasound can really tell you exactly what's going on. So post-operatively, these kids today are going home the same day or first thing in the morning. They don't keep them long. So what do we need to do? Well, immediately post-op, we're watching vital signs. We're getting that pain under control because they wake up and they hurt. They start with clear liquids, and then they'll go into, more of a diet, and making sure the parents know that, to take it easy for the first week with these kids, how to manage their pain and how to increase their diet. Now, Hirschsprung's disease is usually found at birth, but you are mostly right thereafter. It's the descending colon. It tends to have no nerves in it. So there's no peristalsis pushing food down. And all of the secretions, whatever, in the baby's mouth, whatever, starts to fill up the bowel, and it gets bigger and bigger. And it doesn't hurt because there's no nerves in it. So when we feel that, or we see no stooling coming in the first 2 days, we're going to go in and look at it. Why is that going on? So they do a biopsy, an X-ray, do a biopsy, and they do a surgery. And they're going to do either a 2-stage surgery, a pull-through surgery, or a colostomy. And then later on, they'll reconnect usually. Usually it's a 2-stage. Rarely can they just take the piece out and reconnect. So they're all a little different. Gastroenteritis, nausea and vomiting and diarrhea, right? This is very common in children. And why? It could be food intolerance in children. It could be overfeeding them. It could be not making your formula properly, maybe not washing it properly, sitting it out too long, all of those things. And then sorbitol is some of those ingredients. We don't want too much of it. I know it's in the charcoal sometimes we give, so we don't usually give sorbitol anymore. So priority problem in diarrhea is the amount of fluid electrolyte imbalances that's happening. Well, let's look at diarrhea. It's all of your enzymes for digestion. So it's alkaline. All your alkalines being left. So what do I have left? Metabolic acidosis. So that's one thing. You're going to be in an acidotic state. Number two, when you're losing fluid, what electrolyte is always going to be too low? And that's potassium. And remember, we need to keep potassium there, for the heart muscles and the muscles of the body, okay? Severe dehydration is really dangerous in children. So how do we know when we're hydrating that we've done it right? Well, with children, we weigh them all the time. So we weigh them when they come into the ER, which usually are the urgent care. Then we send them up to the floor for getting them fixed. And 2 days later, you can take another weight. And if it's more than the admission, the first one, we know that they're gaining fluid back. We are correcting their dehydration. As simple as that. Celiac disease is all about gluten. It's about a diet. It has to do with the small intestines and the cilia and the absorption. These children cannot have wheat, rye, barley, and oats. No flour. No bread covered chicken nuggets. No macaroni and cheese. No spaghetti, pizza, sandwiches, hamburgers, the bread. No cakes. No. It's a lot of things. We're lucky today, we've got a lot of alternatives. They didn't have it like this 30 years ago. They do now. Rice is a great alternative. These children need to have protein, vegetables, fruit, beans, rice, nuts, dairy, and legumes, and they're losing fat like crazy too. So again, talking about these stools that are going to be malodorous, and we're talking about nutrition, and with them, they're losing fat, almost like your cystic fibrosis. Hernia is when a piece of bowel sticks out through the lining of either abdomen or your groin. And what's neat, if you take and you push it in and out like an umbilical hernia, you push it in and out and it's soft, that's what we want. An incarcerated or is one that you can't move back into place. Strangulated means it's turned and twisted and blood can't get blood. Either or, incarcerated, strangulated, they need surgery now or that bowel's going to die. Again, acute glomerulonephritis is due to a strep infection. Again, you're not urinating. So periorbital edema, you're going to be pale and anemic. You're not going to have urine output. Your blood pressures are going to be up. All of those things. Chronic constipation, common in kids. We don't like to give laxatives. So increase fluids, give the high fiber, and raw vegetables and fruits can be given. Raw fruits, not cooked. GU, we know in urinary tract infections, little girls are the most common to get them. Little short urethras, and they like to sit in bubble baths or these cute little tight little outfits, and it's really not letting your area breathe, and it causes them to have urinary tract infections. Also, how are they wiping? Front to back, back to front, right? When you're potty training, that's the biggest time urinary tract. They should be wearing white cotton underpants. No colors. It's actually better than colors. So white cotton is actually the best. Now, hypospadias is confusing. It's a male, and usually you have urethra and it comes out at the point of the penis. That's where you urinate out of. Well, hypospadias is somewhere underneath, anywhere underneath. And they end up using the foreskin, they open it up, create a canal, and they cover it by 1 year, and these kids do great. Cryptorchidism is the testicles, which means one or both have not come down. Your skin. Let's talk about things that happen there. Impetigo. Christian had impetigo behind his knee. His mother thought he had itched it too much, a mosquito bite, but it kept growing and getting bigger and bigger, and it was oozy and gooey. And I went, this is impetigo. It is a staph or strep infection requiring antibiotics. Very, very contagious. Ringworm is a fungal infection, so you need to put fungal medicine on it. Pediculosis, that's the lice that kids get. They come home and they've got lice, and now you're doing all of the hair shampoos and whatnot. Eczema is an inflammation of very hypersensitive skin. And it could be due to an immune thing. Sometimes there's food things, but it's just that inflammation and the problems when it gets really inflamed. And then it's, oozy and, it's itchy for kids with eczema. The fungal infections, pediculosis, capitis, corpus, pittis, and crus, these are all, again, fungal. You have a little round, skin rash, and they say, and it's a fungal infection. And you're like, but it's a rash. How's it a fungus? Well, put the cream on it, it'll go away. Ringworm, it's a fungus. Scabies, again, this is little animals that crawl underneath your skin. And again, it's the lotions, it's the shampoos, it's probably in the bedding. We find that a lot in hotels. Children get it. Burns, burns, kids tend to pull things off a stove or get into things they shouldn't. And the problem with burns, and especially when it's something that's happened around the mouth, whether it, water, hot water, boiling water has fell down, or smoke, or, you see burns around the mouth. Airway is always number one, okay? Always remember, anything around the mouth and burns, you're gonna be concerned airway. It's thermal, chemical, electric, radiation. I mean, kids, they'll take little cords and bite on them and get electrocuted, and they do all sorts of things. So scabies, I went into, is just the application of permethrin. Again, all people in the house need to be checked, and they all need to be treated. Everything in the house that's a blanket or a throw or a sheet or rugs, everything has to be bathed, and everything has to be washed. I did it 3 times 1 year with my kids, just with lice over and over again. It's the same thing. And then remember, toys and non-washable items, you put them in a bag tight, no air, for 1 week, and they say those bugs will be gone. Again, burns, always worry about anything around the face, worry about airway, that's always number one. Always be careful around the stove, teaching parents about that. And everything, things like outlets and adjusting the water heater. A lot of parents don't realize you can change the hotness of your hot water so that if they turn it on by accident, they won't be burnt. You can turn it down so it won't be so hot. And of course, the escape plan, how to get out in case of problems, and then fluid resuscitation. How do we know that we're getting enough fluid? We're looking at intake, output, we're looking at skin turgor, a lab value is always looking at potassium, sodium, and chlorides, and looking at the mucous membranes, are they becoming moist? So that eczema is that hypersensitive skin, like I said. It could be history or food allergies, like I said. And there's something called lichenification. And this is those thickened type of thick skin because of the amount of inflammation that's been caused in that area due to eczema. The goal of eczema, like I told you, is itchy like crazy. relieve that itching, hydrate the skin, lotions, they believe, but very hypoallergenic lotions, relieving inflammation and preventing infection. Acne in your adolescents, again, how to clean their skin, watching greasy hair products, and there's all sorts of treatments out there today, multiple things. And the one thing about adolescents, they need to be in charge of their care of acne. They need to be shown what they have and how to use it. Metabolic conditions, thyroid. Thyroid, we think hypothyroid. Now remember, hypothyroidism is something that if we have a child that does not have enough thyroid hormone, they're not going to grow the way they should, and cognitively, they're going to be delayed. Children need it to grow. All the signs and symptoms of hypothyroidism in adults is the same as children, except the cognition and growth. The children need that as they're growing. Diabetes mellitus is hyperglycemia because the insulin in the pancreas just not working the way it should. Now, usually in children, when you see it at a younger age, it's type 1 diabetes, which means lifelong. It will never turn to a 2. It will always be a 1, okay? Usually type 2 is your overweight adolescents that we see. That can be reversed with diet and exercise. So what do you see in diabetes? You're hungry, you're thirsty, and you're urinating. P, okay? Polyphagia is hungry. Now, why do kids lose weight with diabetes? Well, they don't have insulin. They can't break down glucose. They're not getting glucose calories. So they're not eating calories, only protein and carbs. And that's hardly any, calories as in comparative. So these kids look really pale and sick, and they have these big weight loss, and that's usually why they come in. Another thing is all of a sudden they're having enuresis or nocturia, wetting the bed at night when they're potty trained. That's a sign of diabetes. Hypoglycemia, important to know, irritable, hungry, weak. You don't move your muscles well. You're just, you don't have sugar. You don't have no energy. Then you're getting confused and you're sweating and you're pale. So the treatment is give them a quick source of glucose. Now, are they alert and awake or are they unconscious? And that will tell you what you need to do. An alert child, you can give them over the age of 1, honey, right? You can give them a pack of sugar, milk, orange juice, something. Now, if they're unconscious, this is the child that will get glucagon. Now, if we have diabetes, it's really gone too far. And now they are blood sugars of 600. And these children come in and they are nauseous. They're not as alert as they should. They look pale. And what you'll see is ketones in their urine because now their sugar's not working. They're not getting it. So they're hungry. The body's hungry. So it goes and it eats fats and proteins and the byproduct's ketones. So ketonuria. Your pH is going to drop a lot. And then you're going to have the smell of fruit on your breath. That is something you'll always remember. Smells like a fresh, ripe peach that you put in a Tupperware container, put it in a refrigerator for a month, take it out and open the lid. It's a rotten sweet. That is the smell that you smell. And of course, they're nauseous. So one of the things with diabetes, make sure that a child has, when they're on trips, going anywhere, they have everything they need with them, making sure that they have some sort of alert, a medical alert on them. And if they're going somewhere, know where hospitals are because kids can go into DKA and, need help. So, diabetes is one of those things you have to be well prepared for. Cushing syndrome is when there's too much cortisol, adrenal hormone we're talking about now. Increased glucose production, and it causes the cheeks, the trunk to be big and stocky. And it's this big moon face, these big reddened cheeks that you see on them, but the arms and legs are normal. The cortisol leads to protein wasting. So that's why your legs and your arms should be thin. And then that hyperpigmentation is those ruddy cheeks I was talking about. So Cushing syndrome, too much steroids. Usually you've been given them orally. So then you have to slowly taper them off. Diabetes insipidus is only 2 Ps, and remember this. Diabetes mellitus is 3 Ps. Diabetes insipidus is 2 Ps. Diabetes insipidus is only about fluid, thirsty, and urinate a lot, okay? It's the pituitary gland. So they drink, and they urinate, and it doesn't matter if they're drinking, they're still urinating. So we're worried about fluid electrolyte imbalance, and we're gonna be looking at those vital signs. Are they becoming dehydrated? Immunity, we have natural, you're born with it. Acquired, it's something you've gotten vaccines or you've had the disease. Active, you made your own. And passive, you give it whatever to the body, but it doesn't last long. You have to keep re-giving it to them. Dosage calculations, guys, I got that sheet for you. I'm going to post that for you. You will have it. If you need any help on dosage calc, here's a short video for you here. It's a YouTube video. Please open it, look at it. It's not that long. And that's all I have for you guys. I wish you all the best. I have covered everything for you. Any questions?